crossing now over to Health Secretary Wes Streeting, who joins us now. Good to see you this morning, Mr. Streeting.
Good morning.
And can I just get your reaction to the markets? Because $10 trillion has been wiped off global stock markets since last Wednesday. We've just had some reaction from Beijing to that threat of additional 50% tariffs from President Donald Trump. They say they will not bow to blackmail, and they say if the US insists on going its own way, China will fight to the end. What's your reaction to the global stock markets and this escalating rhetoric, this escalating trade war that we're experiencing and witnessing right now?
Good morning. Well, a trade war isn't in anyone's interests, and whether or not we are directly involved, we will be indirectly impacted. And that's why the Prime Minister's sought to do three things. Firstly is not only to make sure we're at the best end of the US tariffs already announced, but to make sure that we secure an economic partnership with the United States to further remove trade barriers. Secondly, to try and remove trade barriers with other countries, other trading partners across Europe, around the world, so that Britain stands for free trade and open trade. And thirdly, to make sure we're providing support for British industry to support them against what are very challenging global headwinds now. Heard that we support the car industry, as well as some of the announcements made to support UK life sciences. There's more to come on that front.
We were hearing about this oven-ready trade deal between the US and Britain last week. That still hasn't materialised. Do we have a plan B? What are you going to be doing to supporting businesses in this country in the meantime?
Well, I don't think we've ever overclaimed in that way on a trade partnership with the United States, but we are working really closely with our partners in the United States. Of course, America isn't our only trading partner. We've got the European Union, where we want to break down barriers to trade. We've got the rest of the world, where we want to make sure that the UK is engaged in what are some of the biggest emerging markets of the world, which are way beyond our continent. So there's a lot going on that front. But as I say, this is a challenging global backdrop, no doubt about that. And that's why the action and the leadership the Prime Minister's showing, not just abroad, but here at home, is really important for British jobs and British industry.
OK, Ms. Streeting, I can see that you're in a GP surgery as we speak. That's because you're announcing 1,503 extra GPs have been hired. Where have these GPs come from and how are they being paid for?
Well, bizarrely, when I came in, I inherited this odd and bizarre situation where we had patients struggling to get a GP at the same time as qualified GPs were struggling to find jobs. So I said we'd put 1,000 more GPs onto the front line by the end of March. We've cut through the red tape of one of the initiatives to recruit staff to GP practices, cut through the red tape that stopped practices recruiting GPs, and we've put in place the funding necessary to make sure that we could deliver. And that funding is not just for this year, but for future years, thanks to the decisions taken by the Chancellor. So I want to reassure GBNews viewers on two fronts, really. Firstly is that we're keeping our promises and the NHS is on the road to recovery. But secondly, to reassure people that I'm not for a moment pretending it's job done, and the road ahead is still a long road to recovery. But I hope that with the announcement we're making today, people can see things are beginning to move in the right direction. And through the lack of complacency we're showing, I hope people were reassured that we know there's more to do and we will deliver.
I used to have to use the razor that my ex-girlfriend used to shave her legs. It scratched me and it made me feel weird. But fear not, because Manscaped is back with a game changer. This isn't just any old shaver. We're talking about the Chairman Pro Electric Foil Shaver with two interchangeable skin-safe blade heads. One for that baby smooth look and another when you want to keep it a bit rugged. Get this, it's waterproof. You can use it in the shower, by the pool, or even while scuba diving if that's your thing. This beauty runs for 75 minutes on a single charge. That's enough time to shave your face, your mate's face, and still have juice left over for touch-ups. You'll also get their Power Shave Gel for a proper wet shave experience, and a face shave soother to keep your mug looking fresh and irritation-free. It's like having a barber in your bathroom, minus the awkward small talk. Click the link in the description and use the code GBN for a whopping 20% off and free shipping with the code GBN at manscaped.com. Join the 11 million blokes worldwide who trust Manscaped. Your face will thank you, and so will your wallet.
Though, that you can't fix the front door of the NHS. You can't bring back the family doctor, which is what you're talking about, hoping to do. That's what you're announcing today. If you don't crack down on migration. If you look at the figures from the ONS, which I'm sure you're across, 1 in 6 new registrations in England are from overseas migrants. I mean, in some boroughs in London, over 40% of new registrations are from people who have arrived from abroad. And then you look at the ONS figures that say that the population is going to be up nearly 5 million by 2032. I mean, how do you plan to deal with this?
Yeah, so obviously we talk a lot about illegal migration to our country and some of the steps we've taken since the general election, like the big deportation flights, are important to tackle that problem. What we tend to talk less about, and I think we should talk more about, is our over-reliance on overseas recruitment to plug skills shortages in lots of parts of our economy, including the NHS and our social care services. And while I and many other people will be very grateful to people who come from overseas to work in our health and care services, who make a contribution to our country, I think we would all agree that net migration is far too high, and we need to do much more to recruit and retain homegrown talent in our country. And that is why I'll be taking steps with the Home Secretary to reduce our over-reliance on overseas recruitment.
So what are you going to do to increase training and retain British doctors and British medical students? Because it's something like 2/3 of medics that qualified last year were from abroad.
Yeah, and we've got this bizarre situation where graduates from UK medical schools are competing on an equal basis with overseas applicants for the same jobs. I think that is a crazy position for our country to be in. And as we speak, I am looking at the changes we need to make to put an end to that situation so that students who are going through UK medical schools, that they're the people whose training we've invested in as a country, and they've invested in themselves to make sure that they get those jobs that are available in our National Health Service. And then more broadly, to make sure that we're with the Education Secretary delivering the skills and opportunities to recruit to a wide range of roles in our health and care services with homegrown talent to reduce our reliance on overseas workers, because we all agree net migration is too high. In order to reduce that over-reliance on overseas recruitment, we've got to invest in the skills and opportunities of our own people, and that's what this government's committed to doing.
Can I ask you about this UK first on the front page of many of the newspapers this morning? The first baby born after a womb transplant here in the UK. What's your reaction to that story?
Yeah, I mean, this is an amazing scientific breakthrough, and it will provide real hope to parents, or aspiring parents, I should say, who had maybe given up on the idea they might ever be able to conceive and have their own child. Of course, there are other opportunities and options available, like fostering and adoption, which are wonderful. But this is a really amazing scientific breakthrough. And that's why this week, what the Prime Minister's announced in terms of the Health Data Research Service will be really important for making sure that our NHS is at the forefront of the revolution in life sciences and technology. We want to see more of this innovation here in Britain, and we want to see it benefiting our National Health Service. So really exciting. And actually, against all the challenges in the NHS, this is one of the big opportunities for our country in terms of life sciences and medical technology, which can not only deliver better care and groundbreaking new treatments.
Okay,
it can also deliver
Mr. Streeting, I'm afraid we're out of time with you. We're at the top of the hour, I'm afraid, but thank you for your time.